Hi friends, this is my YouTube channel Nightingale. Please subscribe my channel for more videos related to nursing. And this video including very important and previously asked questions and answers about fundamentals of nursing. And the first question is, stop, drop, wrap and roll is the first aid provided in which condition? The options are drowning, burns, cyclones and accidents. And the answer is burns. The first aid of burn is stop, drop, wrap and roll. Next question. Lack of oxygen in bloodstream is termed as? Options are anoxia, hypoxia, hypoxemia, both A and B. Answer is anoxemia. The anoxia means absence of oxygen supply to an organ's tissue, although there is adequate blood flow to the tissue. Hypoxia means absence of enough oxygen in the tissue. The third question, urine output less than 100 ml is termed as? The options are anuria, oliguria, enuresis and micturition. And the answer is anuria. Oliguria means urine output less than 400 milliliter per day, and enuresis is bedwetting and micturition is normal urination. The answer is anuria. The fourth question, pH of normal urine. The options are 1 to 2, 2 to 4, 3.5 to 6, 4.5 to 8. pH of normal urine. And the answer is 4.5 to 8. pH of urine is 4.5 to 8 and the blood is 7.35 to 7.45. Gastric juice is 1.5 to 3.5. Bile is 6 to 8.5. Intestinal juice is 7.8 to 8 and pancreatic juice is 8. Fifth question, endoscopic instruments can be sterilized by? The options are autoclaving, fumigation, moist heat method, boiling and putting in Sidex. The endoscopic instruments can be sterilized by? And the answer is moist heat method. The moist heat method is a procedure in which heat, high pressure steam is used for sterilization. This is endoscopic instrument sterilization method. And the sixth question is ideal temperature used in sitz bath. And the options are 100 to 105 degree Fahrenheit, 105 to 110 degree Fahrenheit, 110 to 115 degree Fahrenheit, 115 to 120 degree Fahrenheit. And the answer is 110 to 115 degree Fahrenheit. And in sponge bath also 110 to 115 degree Fahrenheit. And temperature in hot water bag is 120 to 149 degree Fahrenheit. And seventh question is cloudy appearance of urine is due to presence of? Options are sugar, phosphate, uric acid and pus. Cloudy appearance of urine. And the answer is phosphate. The cloudy appearance of urine is due to presence of phosphate in the urine. Eighth question, why sugar is found in the urine during pregnancy? Why sugar is found in the urine during pregnancy? The options are due to increased weight, renal threshold is lowered, sugar intake is more, both A and B. And the answer is renal threshold is lowered. During pregnancy, renal glucose reabsorptive capacity decreases, possibly due to reduced glucose transportation expression. Next question, 9th question is Hayes test is test for, the options are bile salt, bile pigment, acetone, sugar. Hayes test. And the answer is bile salt. And Smith test is for bile pigment. Rothera's test and ketone strip test is for acetone, and Benedict test for sugar. Hayes test is bile salt, Smith test bile pigment, Rothera's test and ketone strip test for acetone, and Benedict test for sugar. And 10th question, gangrenous stomatitis is called, options are glossitis, sclerosis, cankrum oris, and stomatitis. Gangrenous stomatitis. And the answer is cankrum oris. The cankrum oris is gangrenous stomatitis. In this, chelosis is due to riboflavin deficiency, that is crackling or ulceration of the lips and angles of the mouth. And glossitis is inflammation of tongue, and stomatitis is inflammation of mouth. The 11th question, which of the following is most important organ in the heat regulation? Options are brain, skin, lungs, kidney. And the answer is skin. Skin is an important organ for heat regulation. And the 12th question is the difference between axillary and rectal temperature. Options are 1 degree Fahrenheit, 2 degree Fahrenheit, 3 degree Fahrenheit, and 4 degree Fahrenheit. And the answer is 2 degree Fahrenheit. The temperature in axilla is 97.6 degree Fahrenheit, oral temperature is 98.6 degree Fahrenheit, and in rectal temperature is 99 degree Fahrenheit. So the difference between axillary and rectal temperature is 2 degree Fahrenheit. The 13th question, bioavailability refers to the relative amount of drug that reaches the options are skin, kidney, hypothalamus, and liver. And the answer is hypothalamus. The bioavailability is relative amount of drug that reaches the hypothalamus. The 14th question, color of sputum in case of pneumonia. The options are brown color, greenish color, rusty color, red color. And the answer is rusty color. The green color is due to cold or flu. The black color is fungal infection. White color, bronchitis. Red in TB and heart failure. And next question, an agent that inhibit the growth of bacteria. The options are bacteriostat, bactericide, bacteriostasis, and culture. Answer is bacteriostat. Next question, 1 grain means, the options are 30 mg, 60 mg, 100 mg, 1000 mg. 1 grain. And the answer is 60 mg. Next question, which position is provided for treatment of shock? Options are prone position, left lateral position, Trendelenburg position, and Fowler's position. And the answer is Trendelenburg position. And 18th question, difference between apical and radial pulse. The options are extrasystole, atrial fibrillation, pulse pressure, and pulse deficit. Difference between apical and radial pulse. And the answer is pulse deficit. The 19th question, enema used to relieve inflammation. The options are purgative enema, astringent enema, stimulant enema, and cold enema. And the answer is astringent enema. The purgative enema is used to induce peristalsis, stimulant enema is used to produce bowel movement, and cold enema used to reduce temperature. The 20th question, enteroclysis is, the options are colonic irrigation, bladder irrigation, ear irrigation, all of the above. And the answer is colonic irrigation. The enteroclysis is colonic irrigation. 21st question, substances that are destructive to living tissue. Options are caustics, diaphoretics, styptics, narcotics. The answer is caustics. The diaphoretic means the drug which increase the action of sweat gland and induce perspiration. The styptics is an agent that check hemorrhage. The narcotic is a substance used to treat moderate to severe pain. Next question, 1 tablespoon is, options are 10 ml, 15 ml, 20 ml, and 30 ml. And the answer is 15 ml. 1 tablespoon is 15 ml, 1 teaspoon is 5 ml, that is 60 drops. 1 glass is 200 ml, 1 pint is 500 ml, 1 ounce is 30 ml. The next question, main organ which metabolize the medicine is, options are liver, kidney, lungs, stomach. And the answer is liver. Next question, administration of drug into the spinal cavity is, options are intrathecal, intraosseous, intraspinal, both A and C. And the answer is both A and C, that is intrathecal and intraspinal. Next question, bandage used to secure rectal or perineal dressing. The options are roller bandage, many-tailed bandage, T-bandage, tubular gauze. And the answer is T-bandage. The next question, most abundant element in the body. Options are sodium, potassium, chloride, and calcium. Most abundant element in our body. Answer is calcium. Next question, physiological buffer in the body. Options are lungs, kidney, heart, both A and B. Physiological buffer in the body. And the answer is both A and B. That is, physiological buffer in the body are lungs and kidney. Next question, which is a nutrient solution? The options are dextrose, dextran, normal saline and Ringer lactate solution. And the answer is dextrose. The next question, solution used for subcutaneous infusion. The options are hypertonic, hypotonic, sugar, isotonic. The answer is isotonic. The isotonic solution is used for subcutaneous infusion. Next question, temperature at which blood stored in blood bank. Options are 1 to 6 degrees Celsius, 1 to 13 degrees Celsius, 13 to 12 degrees Celsius, 1 to 12 degrees Celsius. And the answer is 1 to 6 degrees Celsius. The last question, serum amylase is elevated in which of the following disease? The options are myxedema, chronic nephritis, acute pancreatitis and diarrhea. Serum amylase is elevated in which of the following disease? And the answer is acute pancreatitis. Serum amylase is increased in acute pancreatitis. Thank you. Please subscribe my channel for more videos.